As a doctor, I have observed that wishes are incredibly important to my patients because I treat children with blood diseases and cancer. So when I refer these patients for a wish and they come back after a wish is fulfilled, you are in a sense seeing a different child. The child may have the same illness, the illness may be progressing, but there is that little something. Something changes in that child, in that family. And they come back rejuvenated. They feel that this is one thing that they've had control over, and they feel like $1,000,000 in that sense because they feel that somebody's given them something they've always wanted to do, and this is at a time when their life has been devastated by the most horrific thing that can happen to them. I have referred children for the last 28 years to Make-A-Wish in my capacity as a pediatric hematologist oncologist. And my experience with Make-A-Wish and the wishes and the effect of the wish on the children that I have referred has been just tremendous. Make-A-Wish makes a big difference not only in my patients' lives, in our lives as physicians who take care of these children. Well, the most important part of a wish is really the part where the child says, "This is my wish? You mean something that I want to do?" And it makes them feel very special. And the other thing that makes them feel special is the fact that they get to do something in which they can involve the whole family. And it makes them feel very good because they feel they have the power to do something which will benefit the whole family. For instance, I had a patient who was referred for a wish, and it was very clear that he was not going to make it. And so we called Make-A-Wish, and they kind of hurried, sped up on trying to get a wish. So someone went to his house, got his wish, and his wish was to go on a shopping spree. And he went in a wheelchair on a shopping spree with his two siblings, and he was giving gifts to everyone and himself. And he was superbly excited. It was incredible to see because when he passed away, his grandmother was telling us about it, and it was heartrending. Yet, knowing that child, I knew that he had a blast. And that was very few days before he passed away. So it's an incredible feeling for the kids. You have to tell them that this is a wish granting organization, that they don't necessarily have to be terminal, but there are certain medically clear reasons why we can refer the children. And you need to have that conversation because parents need to know it's not as if you are giving up on the child, but you are doing this, and it really helps enhance care. And having personally seen this, it's not just one wish or two wishes. This is over 28 years. I feel personally quite qualified to say that for me, it's a blessing. I am delighted. I'm overwhelmed by the way this Make-A-Wish fulfills these wishes. It is done with incredible elegance. So I can say that because I have talked to every one of my patients when they come back. The parents are overwhelmed. So for me, it's great. And I've had parents who've come back and who would themselves want to donate, maybe small amounts, but every parent wants to contribute back to Make-A-Wish because they are so overwhelmed and they see the difference in front of their eyes. There is nothing to say, but it's amazing for us. It's amazing for me as a physician. I'm just blessed. The partnership between medical professionals and Make-A-Wish allows you to give these children an opportunity to do something other than just communicate with them about their medications or their prognosis or their what they can do and cannot do. This is like giving them another aspect of their life that can be fulfilled. You can actually you have an organization that has been doing it for years and doing it with incredible grace, that it is just, it's just a win-win for us. And Make-A-Wish, I know, does an incredible amount of work while they work with each and every child. I have not had one child or parent come back and say, this was not what we expected. They just come and say, this is beyond our wildest dreams. I mean, they just have a good time. It's the only time they're not thinking about the hospital. So it's just an amazing organization. It's an amazing concept. So communicating with a parent about the medical eligibility has to be done at the right moment, and it has to be done with a lot of thought. It is important for the physician who knows the child and the family to decide which child is eligible, and also be able to convey that to the parent with with the right amount of, with the correct words and with the right amount of tact. And sometimes there are times where we have to do it in a speedy way so that you get that opportunity for the child to have that wish fulfilled. And sometimes it's a condition where you don't know where things are going to go. The child is going through treatment, but you feel the child is well enough to do a wish that he or she may want to do. And so you convey that to the parents, but at the same time, you give that hope. It's not as if I'm referring your child because I think your child is not going to make it, but it is because I think this would be a good time for your child to have a wish fulfilled. As a member of the Medical Advisory Council, I have learned a lot about the organization by itself. In the past, my connection with the organization was mainly referring of patients and seeing how they came back so excited. But having met the other members of the Medical Advisory Council and having met the medical outreach coordinators, the people who are presidents of the organization, all the people who work in Make-A-Wish, it's like a mold of people who genuinely care. And I know this because I've been in the workforce. I've been a physician for 34 years now, or 35 years almost. And you know when people are genuine, and these people, for them, I don't think it's a job for any one of them. It's a passion. And that passion shows. And I was also privileged to attend a board of directors meeting, and I could see every one of these people had clearly jobs that probably took a lot of their time, but they took the time to come to this meeting, and you could see the energy in that meeting. I feel that as physicians and in hospitals, you can do some things. This is that other dimension that Make-A-Wish gives to families and actually allows the healthcare system or the physicians to expand that dimension in your patient's life.
As the Chief Medical Advisor for Make-A-Wish, my role is, I hope, helping everybody. But for the most part, I work at the level of the national organization, helping chapter staff, helping them identify which kids are eligible, which kids are ineligible, and then also helping them when medical crises arise. These are sick children, they can be very fragile, and we send them to places to have these extraordinary experiences, and unfortunately sometimes that doesn't work out well because of their health. And then I and the rest of our team work to make sure that we're giving them an opportunity to complete their wish and getting them the kind of safety and treatment they need. I feel at some level I'm helping the chapters, but also helping the kids as well. There's no part that doesn't have incredible value. Telling a sick child that they're going to receive a wish can be, as we've heard before, a complete transition in how they feel. and their ability to participate in their treatment, the family's ability to stay cohesive. So just hearing about the wish can be as important as anything else. But there's also no substitute for the memories they have when they come back from their wish. The idea that I'm sick, but man, what just happened was amazing. What Make-A-Wish does, and the reason I feel so honored to be part of the organization, is really beyond the scope of modern medicine in many ways. It's about compassion, understanding, and giving incredibly stressed families something to think about other than the incredible stress of having a very sick child. The impact of a wish is tremendous on families and children alike. We know that when they leave at their sickest and return with this nugget of joy from what they've experienced, all of a sudden how they are handled, how they handle their illness is different and dramatically different. There have been a couple of different studies on impact, and the numbers are astounding how positive people are. It's always above 80% feel that the wish has helped them either with their treatment or compliance. But bottom line is wishes make people feel better. That's what medicine really should be about, making people feel better. They're not always curative, although we feel like they help us with cures. But medicine's not always curative. And in medicine, I think the best thing you can hope for is making people feel better. So how to explain why I would refer a child is fairly straightforward. A child who is so sick that a chance at a healthy life is diminished, and whose whole life has become their illness as opposed to being a child. As I explained to the parents who can afford to do some of these on their own, I explained that has nothing to do with it. It's about allowing a child to step aside from what has been the family focus for that period of time and engage in something so novel, so fantasy-like, that we alter their demeanor, we alter their approach to the illness. The illness isn't all bad. There is something that it's teaching you or that has gotten you from point A to point B. And most of the time when we tell parents that, they're very receptive. So we grant wishes to children with life-threatening conditions. And life-threatening is a very difficult and somewhat subjective term to define. But if a patient is amongst a provider's sickest patients with a condition that offers no guarantee of lifelong success, or lifelong health rather, those are eligible patients. Who we serve are those patients who have the most life-threatening situations, the least likelihood of living a long, healthy life without medical intervention. And that is the population we serve. I think what people don't understand is we get an awful lot of thanks for what we do. People say, oh my gosh, you guys are the best, you're so wonderful. But the truth is, it is the other way around. To work for children and get to give them something that is beyond means is an amazing joy. In every case, brings people to tears of joy and sadness as well, because of course there's hardship. But what an amazing opportunity to be able to work for a foundation that is doing such incredible work. Families who go on wishes, once they've gotten through the hardship, high on their list of next things to do is to volunteer and help us in some other way. And so there's no greater gift than being able to pay it forward. So eligibility, there's been a historical shift in eligibility. When Make-A-Wish started, you had to be terminal, and that is just not the case anymore. Every patient gets considered on a case-by-case basis. It's not their diagnosis that matters nearly so much as how they're doing. We have sick kids with traditional diagnoses like cancer, and sick kids with less traditional diagnoses like asthma or diabetes, who may at times qualify, but every case is handled on a case-by-case basis, and we do our best to find the ones that really fit our mission and remain mission consistent. And one of the ways we're striving to make medical eligibility consistent is through my role as the Chief Medical Advisor, coordinating with local medical advisors to make sure we're using the same kind of linguistics and making our judgment calls less and less independently and more as a group, and interdigitating with the services that are in the hospital setting, the ambulatory clinic setting, to make sure we have really clear pictures of what's going on with each child.
As a doctor, I can say that wishes are important for many reasons. I think as a pediatrician, I chose to help children and to make their health better. And the amazing part about a wish is that we feed children's hearts and souls. And I think it feeds their hearts and souls, their families, their siblings. It gives them hope when so much hope has been taken from them. So it helps patients in countless ways, and I've been so privileged and pleased to be a part of seeing the effects of wishes firsthand. What I've observed in the children I've referred for wishes has been bounding energy and smiles and so much good that it's uncountable. It's just patients, when they plan for their wish, there's that part of it. The sky is the absolute limit. So the wish granters, who are the most amazing people, come in and say, what would you like? And these are patients whose control has been taken from them. They've been hospitalized, they've been in medical care, and now someone's coming to them and saying, you can do anything you like. You can change your room. You can go anywhere in the world. Tell us what you want for yourself, what you want for your siblings, what you want for your families and parents. And it is just the most amazing thing to watch as they plan for their wish, and the excitement grows when they go on their wish or have the wish granted in their home, or to change a room, for instance. And then when they come back, they are different, they are changed, and it's for the better. As a member of the Medical Advisory Council, I have the privilege of interfacing with Make-A-Wish on many levels. I've interfaced with the wish granters. We also identify eligible patients. If there are questions about eligibility, we help. And in addition to identifying and referring my own patients, I also see my role as, I work for the Hospital for Special Surgery in New York Hospital, as sort of a face of the medical community, and spreading the word. So educating social workers, nurses, medical staff about getting patients who are eligible to wishes. And I think I see that as an important role of mine as well, in addition to the other pieces that I mentioned. I would just like to say what a privilege it is to be involved in this organization. The people, the passion, the mission, seeing the benefits, seeing the end point of what a wish means. It is a delight, and it is with grace and beauty that these wishes are granted, and it just changes lives for the better in such a real, amazing, wonderful way, and I'm just delighted to be a part of it.